Hey, Jim Hoffman here for EMS Office Hours. This is your Monday Minutes. Real quick video today, and I want to talk a little bit about stroke and CVA and some things you might encounter in the field that mimic a stroke or a CVA. And some of these might be pretty obvious to you if you've been in the field for a little while. You might really recognize these mimics or understand that a person might be presenting with something that looks like a stroke, but it's really something else, right? But I think it's good to kind of review these key sort of other diagnoses that you can make that mimic a stroke so that you don't get locked into anyone that presents as a CVA, it automatically CVA, and you sort of get that tunnel vision, right? So always kind of keep these things in the back of your mind. And this is talking about being a good clinician, taking a good history, whether it's a current history, the patient's past medical history, okay, all these things to tie in together, including even things like medications that they take, right? If they're diabetic and they're on insulin or something like that, might lead you to believe that they're hypoglycemic or something like that versus a stroke, right? So things that you need to be thinking about when you are encountering a patient with some sort of neurological issue going on, okay? So be a good clinician, take a great history, and then hopefully it'll lead you down the path to some of the things that I'm going to sort of point out today. So what are some of the mimics that we can talk about, right? Well, hypoxia is one, right? Not enough oxygen that can start affecting their mental status. A seizure, of course, is another. Infection, if they have meningitis or something like that, encephalitis, that can also start causing some sort of neurological issues going on. And hypertension, of course, as well. Drugs or alcohol, right? Of course, that can dull or affect the person's neurological activities. And also, any type of electrolyte disturbance might also cause it as well. Okay. Other things we could think about: hypoglycemia, like I mentioned, right? That's a big one. A lot of the time we see that in the field quite often. Things like trauma, especially talk about head trauma or neck trauma, could also cause some sort of neurological deficit in the patient that might mimic a stroke in some ways. Shock, anemia might also do it for a patient also. So, again, taking that patient history, very important if they have a history of anemia to think about that. And behavioral, psychiatric patients as well might have some sort of neurological issue going on that might lead you to believe it's a stroke. So find out, are they on any kind of psychiatric medications, okay? And then environmental, especially when it comes to things like carbon monoxide poisoning or some sort of heat emergency as well, right? Can very easily lead you to believe that it could be a stroke. So again, that patient history, whether especially events leading up to while you are there for that patient, and it can be difficult sometimes because you have patients that are alone, right? So sometimes you have to look at the environment that they're in as well. Okay, so listen, this is a really quick Monday Minutes today. I just want to give you some overview here and to kind of keep these items in the back of your mind when you're assessing your patient for potential stroke, what's going on with them, and keep these highlighted little areas here in the back of your mind when you are assessing the patient. So I hope you can use these Monday Minutes. I hope that they sort of refresh some of this information in your head, and that you take these out in the field with you and you keep these little sort of sidebars in your head. These Monday Minutes are meant to be very quick and sort of highlight individual sections of what we do every day out in the field so that it's always fresh in your mind and that it doesn't just fall away to the side so you don't remember it when you need it the most, okay? Guys, I have a free resource over on the website. It's a neurological emergencies. It's sort of a review for EMS providers. It's absolutely free. It's a PDF download. You can go get it at the website. Just click on this little link here and you can go check it out and download it. Again, it's totally free, and it goes over what I just talked about and much more when it comes to brain injury and neurological issues when talking about patients, especially with strokes and CVAs, TIAs, things like that. So go check it out. Just click this link right here. You can go download it right on the website. Okay, guys, if you have some minutes of your own, be sure to send them over to me. It's contact@emsofficehours.com. Until next week, as always, stay safe. Jim out.